Welcome again to the Medical Terminology Podcast. This episode is Chapter 9, Part 2, Urinary System Pathologies. We're going to start out by talking about the specialties related to the urinary system. What is the word part that refers to kidney? Well, that's nephro, N-E-P-H-R/O. Now, using what you know about medical terminology, what would be the term for a specialist in diseases and disorders of the kidneys? I hope you got nephrologist. Nephrologist. And what is a word part that refers to urine? Well, our combining forms are urino, U-R-I-N/O, and uro, U-R/O. Now, in this case, the specialist in diseases and disorders of the female urinary system and the male urinary and reproductive systems would use the combining form uro. So, what would be the complete term for this specialist? Well, that would be a urologist. U-R-O-L-O-G-I-S-T. A urologist is a specialist in diseases and disorders of the female urinary system, but the male urinary and reproductive systems. Well, let's go ahead now and talk about kidney pathology. And this is an area in the textbook where I think that the presentation is not quite as clear as it could be. So I'm going to try to interpret this and hopefully make it a bit clearer for you. Now, the term I'm going to start you off with is the term nephropathy. N-E-P-H-R-O-P-A-T-H-Y. Nephropathy. Now, this particular term follows our usual word part rules. So, using what we know about our word part rules, what would nephropathy mean? Well, this would mean any disease or disorder of the kidneys. I hope you all remember that the suffix pathy refers to disease or disorder. So, nephropathy is our most general term. It follows the rules. It means any disease or disorder of the kidneys. Now, our next term does not follow the rules. The next term is nephrosis. N-E-P-H-R-O-S-I-S. Using our word parts, we would expect this term to mean an abnormal condition of the kidneys. But this term has a more narrow meaning. Nephrosis means any degenerative kidney disease without inflammation. That is more specific than nephropathy. Nephropathy refers to literally any disease or disorder of the kidneys with or without inflammation. Nephrosis refers to a kidney disease without inflammation. So it is more specific, and we have to be careful of the relationship there between nephrosis and nephropathy. Now, when the kidneys are damaged, a condition known as nephrotic syndrome occurs. N-E-P-H-R-O-T-I-C syndrome, S-Y-N-D-R-O-M-E. And the textbook outlines some signs of nephrotic syndrome. The first one is hyperproteinuria. Hyperproteinuria. Proteinuria. Now, if we parse that, what would that term mean? Hyperproteinuria. Well, I hope you can interpret that as meaning excessive protein in the urine. Remember, the suffix urea refers to urine, hyper means excessive or too much, and protein would be protein. So, excessive protein in the urine is a sign of nephrotic syndrome, meaning that the kidneys are not functioning as well as they should be. The second sign of nephrotic syndrome is hypoproteinemia. Hypoproteinemia. And if we parse this term, what does this term mean? Hypoproteinemia. Well, that would mean low protein in the blood. Remember that emia refers to the blood, hypo means decreased or deficient, and again we have the base word or base term protein. So hypoproteinemia, low protein in the blood, hyperproteinuria, excessive protein in the urine. These are both signs of nephrotic syndrome. A third sign is anuria, Anuria. And again, if we parse that two word parts, an and urea, what does that term mean? Well, an, remember, means without or the absence of. So anuria would mean the absence of urine formation. The kidneys are not forming urine as they should. And there are two other signs that the textbook also gives us. The next one is edema, Edema. And do you remember what edema means? Edema means swelling. In this case, general edema would just be swelling in the body. And finally, the textbook tells us that hypertension and high cholesterol can also be signs of nephrotic syndrome. And then the textbook gives us a term that refers to the inability of one or both kidneys to function. If the kidneys are not functioning as well as they should, we say the kidneys are experiencing, or the patient is experiencing, renal failure. RENAL, failure, FAILURE. So renal failure is the inability of one or both of the kidneys to function. Renal failure can be caused by nephropathy, which is any disease or disorder of the kidneys, or it could be caused by nephrosis, which would be a degenerative kidney disease without inflammation. So nephropathy and nephrosis refer to diseases that can cause renal failure. And when renal failure is going on, that is, when the kidneys are not functioning as well as they should, they can exhibit the nephrotic syndrome, which is the collection of signs. And again, those signs are the hyperproteinuria, hypoproteinemia, anuria, edema, and the hypertension and the high cholesterol. And so I hope that sorts out the relationship between these ideas. I don't think the presentation is very clear as it's done in the textbook. I've reordered them for you, resorted them. I hope this clarifies them. We have the diseases, nephropathy, nephrosis. They can cause problems in the kidney. If the kidneys are not functioning well, we have renal failure, and we're exhibiting the signs, and the signs collectively are known as nephrotic syndrome. Now, to get a little more specific about renal failure, the textbook does talk about three types of renal failure. The first one is acute renal failure. And to review all the way back to chapter 2, do you remember what the term acute means? Well, acute refers to something that has a sudden onset, it has extreme symptoms, but of short duration, and then it goes away. In this case, acute renal failure is a sudden, very dangerous onset of renal failure. It's usually caused by an injury or by a surgery that results in a sudden loss of blood volume and blood pressure. And so that would cause the kidneys to just very quickly shut down. The second type of renal failure is chronic renal failure. And do you remember what the term chronic refers to? Well, chronic refers to something that is ongoing. It's something that is not necessarily life threatening. It's something that a patient has to live with. It cannot be cured, however. It's an ongoing disease or disorder that cannot be cured, not necessarily life threatening. It's something the patient just has to live with. In this case, chronic renal failure is something that would be caused by other diseases, such as a kidney disease, diabetes, or hypertension. And finally, we have end stage renal failure. End stage renal failure is when over time the kidneys have reached the point where they are failing and the patient's going to require dialysis or kidney transplant. And this is something that could happen as the result of a chronic disease or disorder if it's not managed well. Okay, well, that's quite a tangle of material right there. So why don't we go ahead and do some practice on this? Number one, what is the term for a specialist in the female urinary system and the male urinary and reproductive systems? Well, that's the urologist. Urologist. What is the term for any kidney disease that is without inflammation? That's the nephrosis. Nephrosis. And what is the term for excessive protein in the urine? That's hyperproteinuria. Hyperproteinuria. And what is the term for a type of renal failure that's caused by an injury or a surgery? That's acute renal failure. Acutrenalfailure. What is the term for a group of conditions or signs that are associated with kidney disease that include hyperproteinuria and hypoproteinemia? Well, that's nephrotic syndrome. Nephrotic syndrome. What is the general term for any kidney disease? That's nephropathy. 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 What is the general term for the inability of one or both kidneys to function? That's renal failure. RENALFAILURE. What is the term for the absence of urine formation? That's anuria. ANURIA. And what is the term for a specialist in the kidneys? That's a nephrologist. NEPHROLOGIST. And what is the term for the condition in which the kidneys are failing completely, requiring the patient to undergo dialysis and/or kidney transplant? That's end-stage renal failure. ENDSTAGERENALFAILURE. End-stage renal failure. Okay, and for a third part here, there are some terms related to conditions affecting the kidneys and the ureters that are related, so I'm lumping them together, and they tend to be just a little confusing, so I'm going to go over those with you. The first one is hydronephrosis. HYDRONEPHROSIS. And notice it has the prefix hydro, HYDRO, which refers to water or fluid. And then it has nephrosis. And again, what does nephrosis refer to? That's any kidney disease without inflammation. In this case, hydronephrosis refers to a swelling of a kidney that's caused by a backup of fluid due to a stricture. And a stricture is like a blockage or a narrowing. What would usually happen in this case is a ureter could be blocked by something. And this causes a backup of fluid into the kidney, and the kidney will swell up with fluid. Hydronephrosis, swelling due to fluid. The next term is nephrectasis. NEPHRECTASIS. If we parse this down, we have nephro plus ectasis. And based on those word parts, it should mean like an enlargement of the kidney, right? Because nephro refers to kidney, ectasis means a stretching, a distension, or enlargement. Well, in this case, it's a little narrower meaning than that. Nephrectasis refers to the distension or enlargement of the renal pelvis. And this case is not necessarily caused by a backup of fluid. It could be caused by other things, okay? And that's an important point to keep track of, is that hydronephrosis, swelling of a kidney because of fluid. The key idea is hydro, fluid is involved. Nephrectasis is a distension or enlargement of the renal pelvis, not necessarily caused by fluid. Now we have another pair of terms here that operate the same way. The first one is hydroureter, HYDROURETER. Now, comparing that to hydronephrosis, what would hydroureter mean? Well, hydroureter would mean a swelling or distension of a ureter that is caused by backup of fluid due to a stricture. Something further down the line is blocking the way, so the ureter is swelling up. That's just like with hydronephrosis, the kidney is swelling up because something down the line is blocked. So those two terms work the same way. Then we have ureter ectasis, ureter ectasis. And if you compare that to nephrectasis, what would that mean? Well, ureter ectasis would mean the distension or enlargement of a ureter, possibly for a variety of reasons, just like nephrectasis means a distension or enlargement of the renal pelvis. Okay, so those are some points to keep straight. These terms work similarly. If hydro is involved, there's a backup of fluid involved. But if there's no hydro in the term, but we have ectasis, then it's just distension or enlargement in a more general sense. Okay, and then for part 4, we're going to look at stones. First of all, do you remember the suffix that refers to stone? We learned that in the last chapter. I hope you remembered the suffix is lith. -lith refers to stone, lith. Now, using our knowledge of word parts, what would be the term for a kidney stone? Well, that would be a nephrolith. Nephrolith. Nephro means kidney and lith means stone. Nephrolith, kidney stone. What would be the term for a stone in a ureter? That would be a ureterolith. Ureterolith. Ureter or uretero means ureter, and lith means stone. And finally, what would be the term for a stone in the bladder? That would be a cystolith. Cystolith. Cysto refers to bladder, and lith means stone. And these are all the different places that stones could happen: a kidney, a ureter, the bladder, and the terms that go with them. There's one final term that tends to be missed on tests that relates to stones, and that is renal colic. Renalcolic. And this is, I think, kind of an older term. It doesn't have any logic to it as far as our word parts. Renal colic means pain in the kidney area that's caused by blockage during passage of a kidney stone. Okay, and even though I've led you kind of inductively with questions and answers through these last group of terms, it won't hurt to go ahead and do some more practice. Number 1. What is the suffix that refers to a stone? That is lith, -lith. What is the term for the swelling of a kidney caused by a backup of fluid due to a stricture? That's hydronephrosis. Hydronephrosis. Key idea there, backup of fluid due to a stricture. That should tell you need hydro in the term. And what is the term for a kidney stone? That's a nephrolith. Nephrolith. And what is the term for the distension or enlargement of a ureter? That's ureter ectasis. Ureterectasis. And what is the term for a bladder stone? That's a cystolith. Cystolith. What is a term for pain in the kidney area caused by a blockage during the passage of a kidney stone? That's that odd term. It's renal colic. Renal, and then colic, colic. What is the term for distension or enlargement of the renal pelvis? That's nephrectasis. Nephrectasis. What is the term for a stone in the ureter? That's a ureterolith. Ureterolith. And finally, what is the term for the distension of a ureter caused by the backup of fluid due to a stricture? That's going to be hydroureter. Hydroureter. Again, backup of fluid tips you off that we need hydro. Okay, well, we've covered quite a bit of material already. There's still quite a bit to go. As I mentioned earlier, this chapter does have some more material in it than the last two. So this is going to end this episode of the Medical